Hi, I work with Dr. Jim Amos. He's a staff psychiatrist at University Hospital in Iowa City, and this video is an accompaniment to a blog post about clinical neuroscience as a part of psychiatry. And the sense I get is that there are different perspectives on the usefulness and practicality of clinical neuroscience in training psychiatry residents. And Dr. Amos will have a little bit to say about that. One of the articles that prompted the writing of a blog post, which this video will be a small component of, was published in JAMA Psychiatry in March. And the title of it is "The Future of Psychiatry is Clinical Neuroscience. Why Not Now?" And the challenge of learning clinical neuroscience like it's the back of your hand could be being proposed by those who want to also regulate it as a part of psychiatry certification, which does sound an awful lot like maintenance of certification, which Dr. Amos has talked about. It sounds like it could be part of a heavy-handed approach, and finding clinical neuroscience science faculty to teach this rapidly changing topic, I suppose you could find them by letting your fingers do the walking, but I suspect that it's kind of hard to find them just by looking them up in a phone book. And a lot of the concepts in neuroscience are difficult, and some of the applications are probably a little bit difficult to find for practical use. A lot of times it seems like there's a lot of hand-waving that goes around when we start talking about how clinical neuroscience could inform psychiatric training and psychiatric practice. Well, okay, that gets at maybe the basic idea, but the issues that I have with clinical neuroscience are not that it's a bad idea. I think we could use clinical neuroscience very effectively in psychiatric residency training programs. However, the article already referred to as "The Future of Psychiatry as Clinical Neuroscience, Why Not Now?" is important in that there is an indication that the authors might believe that this should be part of the maintenance of certification program. And I'm just going to quote from the article itself. We should work with regulatory organizations to formally incorporate neuroscience into our training and certification processes. Such an approach could include revision of the program requirements and milestones for psychiatry and greater incorporation of neuroscience content into the American Board of Psychiatry and Neurology certification process for psychiatrists. I happen to think that's a bit heavy-handed. Thousands of psychiatrists hate maintenance of certification, and even the American Psychiatric Association is asking the American Board of Psychiatry and Neurology to ease up a little bit, especially with Part 4 requirement, the performance in practice. So the little video is probably best viewed, as already pointed out, in conjunction with the blog post. And I'd invite you to look at it so that you don't get the idea that I'm totally opposed to clinical neuroscience as a part of psychiatry. In fact, I agree with its inclusion. I just don't want it to be regulated, and I'd like it to be practical and relevant to our practices. Thanks very much.